I'm Nurse Taylor. I'm going to be with you today. I just wanted to come and introduce myself and also let you know we're going to do a health assessment.
Great.
It should take a little less than 20 minutes.
No problem.
Can you tell me your name and your birthday?
Yep. Hoji Young, September 1887.
Okay. And I'm just going to check your bracelet. Great. Okay, Hoji, do you know, is that okay if I call you Hoji?
Yeah.
Perfect. Do you know what season it is?
Summer.
Okay, do you know the date today?
August 8th or 9th. I
Okay.
just can't remember.
Sure, I know, things get lost in here. Okay, and do you know what year it is?
2018.
Okay,
And it's Friday.
It is a Friday, you're right. Okay, great. So I'm gonna do an oral assessment here. What I'm gonna do, this might be just a little uncomfortable, it shouldn't hurt. I'm gonna just have you open your mouth and I'm gonna put this in the back of your throat and just do a gag reflex. Just a little pressure in the back of the throat. Open up for me. Say ah. Stick out your tongue all the way. Okay. And now I'm just gonna push this back. Okay, great. That's good. That's normal. You okay?
Mm-hmm.
Okay, great. And you're not in any pain or anything right now, right?
No pain.
Okay, great. So I'm gonna just check your pupils. What I want you to do is stare at the tip of my nose.
Okay.
I'm just gonna shine this light in one eye at a time and 2 times. Okay?
Sure.
Great. Looks good. Okay, now we're going to do an acuity test. So I want you to actually stare at this finger, and I'm right now, but I want you to follow this finger.
Okay.
So we're going to come back to center each time, okay? So following this guy. Great. Awesome. Okay, now I'm going to wiggle my fingers, and I just want you to tell me when you can see them, okay? So we're going to do 4 different directions. Can you see my fingers from here? Okay. Can you see them wiggling?
No.
Okay. Let me know when you can see one wiggling.
Yep.
Okay?
Yep.
Okay, great. Can you see my fingers on the side?
Yes.
Okay. Can you see them wiggling right now?
Yes.
You can?
Mm-hmm.
Already?
Yes.
Right here? Can you see them?
No.
Okay. So I'm coming in.
See it.
Okay.
See it.
Great. And coming from the bottom here? Same thing. Can you see my fingers wiggling now?
No.
Great. Let me know when you can. Okay.
Yep.
Okay.
Yep.
Great. They're even. Okay, good. So we've got your mouth, your eyes here, and we're actually going to check, I'm going to check your vision now. So if you see this test here, I'm going to have you hop down, and we're actually going to head 20 feet away. Okay, so just walk right over here to this point. There's a mark on the floor. And I just want you to read line 4 for me in order.
Okay. L-P-E-D.
Okay, now cover your right eye for me. Okay, now can you read that same line?
L-P-E-D.
Can you read line 6 for me?
E-D-F-C-Z-P.
Okay, and can you read that line? Read down as far as you can see clearly.
L-E-F-O-D-P-C-T.
Okay, great. Now cover your other eye for me. And can you read line 6?
E-D-F-C-Z-P.
Okay, can you read line 8 for me?
D-E-F-P-O-T-E-C.
And can you read line 9?
L-E-F-O-D-P-C-T.
Okay, looks good. And you don't wear contacts or glasses?
I wear contacts.
So this is with your contacts?
Yes.
Okay, great. Come back over here. We'll have a seat back on the bed. Okay, go ahead and have a seat for me. All right, couple more tests and then I'm gonna have you lie down.
Sure.
Okay, so real quick, can you give me a smile? All the way through. Okay, can you try and frown? And can you blow? There you go, perfect. Okay, now I'm gonna test something dull and sharp on your arms and your legs, okay? So this is what we would consider dull.
Okay.
And it's just a pen tip. This is what we would consider sharp.
Okay.
Okay? So I'm just gonna have you tell me what you feel.
Sure.
Sharp.
Dull. Dull. Sharp.
Okay.
Oh, sorry. Dull. Sharp. Sharp. Sharp.
Okie doke. So I'm gonna do an auditory test for us, and then I'm gonna start listening to your sounds.
Okay.
Okay, so I want you to plug one ear, plug your right ear.
Am I ready?
Okay. Okay. And I'm just gonna whisper 3 words.
Sure.
And I want you to just repeat them.
Okay. Sunrise. Balloon. Simple.
Okay. Now cover the other one. Everything's good. Okay, so I'm gonna take a listen to your lungs, and then we'll listen to your heart, and I'll have you lie down, okay?
Sure.
All right, so first I want you to just breathe normally for me.
Okay.
Great. So that's 14 breaths per minute, which is normal. Okay, so what I'm gonna do now is I'm gonna, and you know, would you be okay, would you feel comfortable removing your tank top for me?
Sure.
Great. Okay, so you're just gonna feel me auscultating with the head of this stethoscope here and also palpating
Okay.
and percussing, so just light taps.
Mhm.
So I'm just gonna ask you to take a deep breath for me. Exhale, there you go. Again. 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 Sorry, I'm gonna come underneath here.
It's okay.
And again here. And 2 more times. One here. And 1 more deep breath. Great. Okay. So here's what I'm gonna ask you to do.
Mhm.
I want you to take a big inhale and exhale all the air out that you
Okay.
possibly can. And just hold that at the bottom of that exhale, okay?
Okay.
Go ahead. Okay. You're just gonna feel me tapping. Okay. Doesn't hurt, right?
Mm-mm.
Good. Okay, you can breathe. Thank you. Okay, now what I want you to do this time is just take a big inhale and hold that inhalation, okay?
Okay.
Okay, thank you very much. I was just measuring your depth there.
Okay.
And now I just want you to do one more big breath for me right here. Sorry, I'm so sorry. I should have warned you my hands are
No.
cold.
Yeah,
Oh,
it's
sorry.
okay.
Okay,
Okay.
we'll try that again.
Okay.
I'm so sorry. A little surprising. Okay, bear
Okay.
with me. Okay. You ticklish?
Yeah.
Okay. Inhale and exhale. Okay, great. So sorry about
Sorry.
that. A little torture for you. Okay, I'm gonna now listen to your heart sounds and just a few more lung sounds on the
Sure.
front. Okay. So I took your respiratory rate. I'm also gonna take your cardiac rate. Okay, it's on your neck. Nice and clean. Perfect. Okay, great. So I'm actually gonna take your heart rate for you.
Okay.
89 beats per minute. Does that sound about
Yeah.
normal for you? Okay. Good deal. All right. So I just want you to breathe normally for me. I'm just going to listen to a few more sounds. Okay.
Mm-hmm.
Okay. Okay, don't mind me. I'm just going to
Sure.
a little bit. Okay. All of that sounds great. Okay, still comfortable?
Yep.
Okay, great. So I'm actually going to have you lie down for me. And I'm just going to do a few physical assessments. I'm going to check your skin turner. Great. And your skin feels warm, normal, warm hands. Do you normally have warm,
Yes.
moist hands? Okay. Do you mind if I remove your socks?
Sure.
Okay, great. Okay.
Sorry.
No, you're good. Okay, so what I'm going to do is I'm just going to assess your pulse points.
Sure.
So I've got your carotids right here. I'm just going to do one at a time. Great. Okay. Now your brachial. Okay, I would say those are all twos. I'm going to get your radial. That's a two as well. And I didn't find any pulse deficits between your heart and your radial pulse, so that's good. Okay, now I'm going to just have to dig my fingertips in right in your groin area, right here, just to get a femoral pulse, okay? Is that okay?
Yeah.
Okay. Are you ticklish here?
No.
It's an excellent pulse. Great. Bend your foot up for me. Put it flat, or bend your knee. There we go. This doesn't hurt?
No.
Okay, good. Okay, and now I'm just going to get your posterior tibialis pulse right here. Great. Now your dorsalis pedalis.
Mm-hmm.
Okay, good. Those are all twos. And I don't see any swelling. Normally no swelling in your hands or your feet. Okay, good. And I'm just going to touch and hold onto one of your nails. I would say that's a 1 second, essentially instantaneous.
Good.
That's good. Now I'm just going to push. Sure. Let me know if that hurts.
No.
No. Good. Does it hurt? Okay, great. So now we're just going to do a little range of motion action.
Okay.
So what I'm going to have you do is, do you feel like you have any inhibitions, anything that's going to stop you? Okay. So I just want you to raise your left arm all the way up over your head and all the way back down. Okay, can you take it out to the side and bring it back in? Can you cross your body? Great. Come back center. Can you roll over your palm and then back over? Great. Can you bend at the elbow? Can you wave? Can you spread your fingertips? Can you touch each one to your thumb? There you go. Okay, now can you take your arm out to the side like this? So if you bend at the elbow here.
Oh, okay.
Yep, okay. And now can you take that arm and bring it down and back up? Great, and then you can bring it all the way back. Okay, now we're gonna go ahead and do your leg. So the same thing, can you bring your left leg all the way out? Great, and back in. Pretty flexible there. Okay, and can you bring that leg all the way up? Great, and back down. Can you bring that leg over and back? Okay, and can you bend at the knee all the way up? There you go, and back down. Okay, can you point and then flex your toes? Can you spread those toes for me? Awesome. Can you roll that ankle out to the side? Yep, just like that, and then back in. Okay, and now can you windmill your toes as much? Yep, and then rotate back. Great, great range of motion there. And one more thing, I'm just gonna have you sit up as high as you can, just using the bed. Great, looks good. Okay.
You want me to sit up?
So actually, no, I'm going to do a strength test real quick. So I want you to oh, you know, we didn't assess your neck. If you will, take your head and lean to the one shoulder. Great. And to the other. Okay, and now I want you to look towards that wall. Now look towards that wall. Can you tuck your chin? And can you lift your head? There you go. Okay, great. Okay, now we're gonna just do a strength. So what I want you to do is wherever my hand is, I want you to put pressure against it. There we go. Okay, and now chin down, chin up. Yeah, there you go. Great. Okay, same thing with your arm here. So go ahead and push your arm all the way up. A little more. Yeah, there it is. Okay, and now back in. Great. And now I'll test your forearm. So if you'll bend up. Okay, so now I want you to push using your forearm strength down towards the bed. There you go. And now I want you to push back towards me. Very good. Okay. And now your wrist, I want you to push against my fingers as hard as you can. Very good. And back against. Perfect. And now I want you to grip these two fingers.
Okay.
There we go. Very good. Great. Okay, awesome. Same thing here with your leg. Push all the way out towards me. Beautiful. Now pull in. Great. There you go. Bend at the knee. Okay. Same thing with this. I want you to almost kick your leg forward.
Okay.
There we go. And back. Nice. And then I want you to push your toes all the way in. There it is. And all the way back. Nice. And no pain in any of that, right? Great. Okay, awesome. So we are done here, but the only thing I want to test is I do need to get your GI sounds, and then I'm going to have you go for a little walk, and then we're good.
Okay,
You
great.
okay with that?
Yeah.
Good deal. So I'm just going to have a listen for 15 seconds in each quadrant here. When was the last time you ate?
Maybe 2 o'clock.
2 o'clock. Chatting.
I know, my stomach is very active.
It's okay.
I can feel it.
Awesome. Okay, good too. I'm gonna lower the bed. If you will, just swing your legs over and just sit up for just a second. I don't want you to like hop up immediately. You've got your socks. Okay, so I'm gonna hand you something that I want you to read. If you could.
Okay.
Hold this right here
Okay.
and just read what you see.
Product facts: uses for removal of oils and residual residue from skin. Directions: apply to skin as needed. Do not get into eyes. Discard after single use. Do not apply over large areas of the body. Irritation and redness develop.
You're good. I won't torture you anymore.
Okay.
Perfect. Thank you. Okay, cool. Hop on up.
All right.
Okay, just take a walk to the wall there.
Okay.
Okay, cool. I'll come back to it. All is well. Okay. Thank you so much.
No problem.
Do you need anything else?
No, I'm good.
Okay. All right. Thanks, Dr.